BM, BMJ Ayurvedic Medical College, Hospital and PG Center, Gajendragada. Due to some technical issues, we are not able to have proper, starting welcome and all. So, not needed. Actually, it's the purpose is sharing the knowledge exchange. Actually, it was planned for one more eminent person for a physical event, as it was planned as a physical event, but somehow that faculty was not able to make it to the event. So I was asked to conduct this one. So I'm doing it online, and it is anything what you can call in an emergency kind of situation. I'm doing. So hope we will start. And first of all, I'd like to thank NH Kulkarni sir, Principal, BMJ Ayurveda College, Gajendragada, and also Inamdar sir for inviting me as resource person. Keeping apart the formalities, we'll start with the webinar. So today's topic is application of principles of Agatantra in Ayurveda dermatology. If at all anything like in between miss, if I'm not audible and all, please write in the chat box, or you all have sent in Q&A, so no problem in that. Also you can write, okay, if at all there is any issue with the voice and all. Hope my slides are visible now. Can I have one more yes or no? My slides are visible? Hello? Please text in chat or in... Yes. Okay. Thank you. Thank you, everyone. So today we are going to discuss about application of Agatantra principles in the practice of Ayurveda dermatology. See, now Agatantra is made as a clinical branch, and it is made mandatory for each and every Agata faculty to run OPD, Agatantra OPD. As I'll be trying to explain it for both. It should be what for those who are in higher, like in PG, or we are in practice or teaching, and simultaneously the students. In this, as per my knowledge, second BMS and third BMS, or those final year students and the other students, UG students are there. So I would like to ask them that don't take that whatever we are going to discuss in this, don't take it's it's too heavy or too much for understanding. It's very simple, but still, if you feel like that, this you take as an eye opener. You take it as something which is trying to create an interest in you to use Agata Tantra principles in your future practice. Okay, at least this webinar, through this, if I am able to accomplish that, or if I am able to convince you that the application of Agata Tantra principles or Agata Tantra has got lots of potential in clinical practice. Now today we'll be discussing about how the role of Agata Tantra in scope of Agata Tantra in Ayurveda dermatology. Okay, so don't worry, even if it goes sometimes, if you feel it is difficult to digest, don't worry. Even if it creates a kind of interest or belief that Agata Tantra applications has got a potential role in the clinical practice, that will be sufficient for the second BMS or those who are learning Agata. Final years, of course, I think they will understand. Okay, just a minute. So this is one of my favorite quotations. Most of my lectures, whether it is an Agata Tantra or dermatology, have most often started in this quotation. We should never forget this, right? Three Sutra principles. Very first chapter of Charaka Sutra Sthana, it is said that Ketulinga Ushada Jnanam Swastatura Paranam, Three Sutram Shashvatam Punyam Bhugudeyam Pitama. See here, the Shashvata word is dependent on Three Sutra. Means what it says, Ayurveda origined in the form of Three Sutras. Not only that, the Ayurveda can remain as long as we practice Three Sutra principles. As long as we bring in, as long as we apply all the Three Sutras like Hetu, Linga, and Aushadha Jnana. Hetu Jnana, Linga Jnana, Aushadha Jnana of well-being and the treating of the disease, okay, or of a disease. Now, most often what happens in clinical practices, we neglect Hetu. Very commonly it is we neglect Hetu. We focus more, mainly on the clinker presentations, Linga, and we focus, next focus will be on Aushadha, right? We focus on the medicines. But Hetu is mostly neglected. And when we look into the Astangas of Ayurveda, Agatantra is the branch which directly studies or which directly focuses or which is mainly focusing on the Hetu. Because Visha, first of all, is Hetu, then a Vyadi or a Roga, right? So Visha is a Hetu because in Visha, Agatantra, whatever Lakshanas or clinker presentations you are going to see, none of them are new to you. They all are explained or you have studied all of them in either in Kaya Chikitsa or in Nidana in one or other disease only. Okay, even if a disease itself is coming like Shota as a result of Visha, then also you will be studying that Shota in disease, right? As a Shota as a disease. So none of the clinical presentations are new. Means what is changing is disease is same, clinical presentation is same, but the etiology is different. In some, it is caused due to Viruddhara or something else. In Agada, whatever we see, here it is caused due to Visha, right? So basically, when we read into the text, like for example, you take example of Jora, Abhishanga Jora, if it is caused due to Vishaja Jora, Acharya Charaka, Sushuta and Ashtanga Devak, also says use Vishagna. Vishajit Jayat, right? You do Vishagna Chikitsa, means by Vishagna Chikitsa only you are going to cure that Jora. Shota, again, Vishaja Shota, treat for Visha, you will get rid of that. Like that, so many conditions, wherever the disease is caused due to Visha, there Acharyas have recommended that we need to treat for Visha. Now, in olden days, ancient periods, the source of exposure of Visha was very less. Like whatever we see, like Annapana, Danta Kasta and all, they all were mostly of intentional poisoning. They were of intentional nature, means intentionally adding poison. Okay, people were very much organic. Okay, they were very much connected to the nature. They were using them as it is. So there was no scope for any kind of entry of any kind of poison. Otherwise, it is a bite, sting, or something like that, or accidental exposure. But whatever we see in the Adhisthanas, so they all are intentional. So that is why Hetu, Visha as a Hetu for most of the diseases is very minimal in ancient time. It's very minimal. But when we look into present era, Hetu, Visha as a Hetu is the highest graded Hetu in our disease, irrespective of the disease. Any disease is Visha or a poison. Like consider a simple toothpaste. We start our day with brushing. It contains almost 4 to 5 types of chemicals which are toxic. They are said to be what you can call EDCs, endocrine disrupting chemicals, right? And when we go to the bed with a mosquito coil or something like that, that is also a poison. In between, innumerable poisons we get exposed. The soap we use, the oil we apply, the food we eat comes with pesticides, fertilizers, preservatives. The oil that we eat for cooking. Now we are getting 120, 130 rupees a liter oil. Is it possible to get groundnut oil for 120 rupees 1 liter? Impossible, right? 200, 300 rupees kg, 1 kg groundnuts are there. And to extract 1 liter of groundnut oil, it takes almost 3 to 4 kgs of groundnuts. Means by investing 800 rupees or 700 rupees, getting 1 liter oil and selling it for 120 rupees or 130 rupees or so, is it possible? Never. It is not possible. Means whatever oil that we are using on day-to-day basis itself is a chemical. It is a contaminated one. So likewise, so many things are there, right? Everything that we get exposed is in one or other way is a poison. So whatever disease we get now, all the diseases have got major share of poisons or the toxins, what we can call those low potent poisons as the etiology. So that is why, my dear friends, now application of Agarthantra principles, I'm telling in broader spectrum, like I will not come into the dermatology, but as a broader section, I am telling means when you are reading Agarthantra, you should keep these things in your mind. Like whatever disease is there, only thing is we need to be a blending. There should be a blending of Kaya Chikitsa and Agarthantra. How we can blend? I will explain you by giving example of dermatology. So we have to take Kaya Chikitsa principles and Agatantra principles, and they should go hand in hand. And then we will get a very good result. Otherwise, what will happen? Now it will become only Guna and Aushadhnana, sorry, Linga and Aushadhnana, and we will treat, but we may not get what you can call expected outcome. There may not be, good or successful outcome. So that is why we need to be very much, focused about understanding the hetu. So irrespective of the disease, present day, all diseases are being caused as a result of one or other poison. So as long as we are going to adapt for that, okay, there is one very famous movie, Undisputed 3. If you're interested in boxing kind of movie, it's a fight movie. In that, there is lead role Mr. Boyka, and his friend will be there. And his mantra for success is adapt, improvise, and overcome. Now, this is a time where the etiology has changed completely. Now, if we are not going to adapt accordingly, then we will not get the right outcome. So, all of you, whoever is studying Agatantra, always keep in mind that whatever you are going to practice in future, 100%, if you want to be successful in that practice, clinical practice, you must and should use Agata principles. You must and should use Agata principles. Then only you are going to get 100% outcome. Right? Okay, I'm not exaggerating. I'm telling the reality. Even you will find all these explanations if you go and visit WHO website, which is the most reliable source we call in the field of healthcare. Right? You can go and search for the chemical induced things. Innumerable are there. Okay. So, this, like when we consider the Hetu, we will now move towards dermatology. In Hetu only, we can say that Hetus are, for practical purpose, we can consider them as Mrudu, Madhyama, and Tikshna. Means, Mrudu is something which takes over prolonged period of exposure. Then the pathology sets in and disease is caused. Madhyama is less intermediate, the interval. And Tikshna are acute. Right? A bite. Now, a bite is there. Within minutes, we start getting itching or something like that. There is a rash, depending on the type of the bite. Like if there is Ballataka comes in contact or acid falls on the skin, what happens? Immediate. So, Tikshna. Like if you eat a chili, right? You eat a Gouda, then also we get sweating. After eating Gouda, how much time it takes to generate sweat? It will be a little bit more. If you eat a chili, immediately you start sweating, right? So that means the Tikshnata. Okay, it depends on that. So depending on the type of Hetu, the disease is also caused. Mild, moderate, and severe. Right? This is like that. So, but treatment, whether we have to change the treatment accordingly or not, we need to change. But most often what we learn is, how we learn is, one disease, one name, or one disease, set of medicines. Okay, that is not the way to learn Ayurveda or practice Ayurveda. So that is why we need to be more evolving. We need to be more adopting. Like, let me start with patient. This is a herpes patient. Here you can see on the face, even oral cavity and on tongue. Now, what is the etiology when we look into this? In our Samhitas and all, we come to know that it is having Tikshna, Ushna, Katu type of Pittakara kind of, etiology. So, what should be the treatment here? When you look into the clinical presentation, like Pitta, Tikshna, burning and all is there. So we have to go with Somya, right? Pitta, Shamana and all, right? Now, what was given in this? Patala Katvanadi Kashaya, Bilwadi Agada was given. And after 5 days, you can see the outcome. Just 5 days, patient is completely okay. No burning, nothing. Only scars are remaining, which takes some time. And again, they will disappear. Okay, the scars will disappear later. Now here you can see there is discoloration, bindi allergy. We gave Dushi Ushari Gulik Agada and coconut for 3 days. After 3 days, you can see the patient was very much, frightened of this hypopigmentation, thinking like it may get converted into leukoderma or something like that. But in span of 3 days, it was reduced. Why it was caused? It was caused due to glue allergy to that bindi. So, what have we done? What we have done, that I will explain. All of you know Chaturvamshi Deepakarmas, right? You all have studied. We all have studied. In that, 3 are very important that I consider for usually explaining. They are Prativisha, Aushadha, and Prashaman. Now, Prativisha is administration of Visha against Visha. Okay, we will leave that one. Now, left out are Aushadha and Prashaman. Now, Aushadha is Vishagna Prayoga. like what we gave Bilwadegada or Dushi Visharagada, that we are giving based on this Jnana. Now, Prashamana means dosha specific Shamana we are giving. From where we are getting this idea? Vishakna Prayoga, from where we are doing? We are doing it from Agata Tantra principles, right? This is Agata Tantra principle. Doshakna properties, karma, from where we are studying, we are getting it from Kaya Chikitsa principles. So this is called as blending, right? Hetu from us, we treat Hetu with our principles and then treat the Lakshanas with Kaya Chikitsa principles. Like there are some formulations. For example, you may say, sir, Patala Katranyadi is Vishagna, so no problem. But that is one example. Like that, there are so many things are there. Like we are using Chandana, so Punarnamati Kashaya. For example, if Shota is there. Now there is a bite or sting or Visha is there. So because of that, there is Shota. Now what we use Agadas. Consider one Agada, Bilwadegada or something like that we are giving. We are giving that because we have the knowledge of Agatantra, right? Because of the knowledge of Agatantra, we are giving Bilwadegada. Now, from where we are getting the Shotagna knowledge? We are getting it from Kajvisalaya. Okay, we are getting it from, you may say that, sir, it is from Dravyaguna, but Dravyaguna can be considered as part and parcel of Kajvisalaya, right? Because in Ashtangas, it's not there. So, it is part and parcel of Aushadhi Dhyana, which is one of the part of Kajvis, right? So, we are getting that Shotagna property from Kajvisalaya. Like burning sensation is there. So, for that, some bite or some Visha exposure, burning. So, for Visha, we are giving Agadas based on Agada Tantra principle and Daha Prashamana, like Chandana Seka, Ushira Seka, something like that. Even they are explained in Agada Tantra also, but they are based on Kajikis. Okay, the principles are based on Kajikis. So this is what I call as blending of Agada Tantra principles and Kajikis principles in treating dermatology. It is applicable to each and everything you can use that. Now in this patient, what we did, Patala Katroinadi, Kashaya is Prashamana, right? And Bilwadegada is Aushada. Means Bilwadegada is targeting the Hetu, Patala Katranyadi is targeting the result, Lakshanas. So in Bindi allergy, coconut oil was Prashamana and Dushi Visharagada was Hetu, right? For Hetu, it was used as Aushada. Okay. So in this Bilwadegada is Tikshna, Dushi Visharagada is Sound, right? So when the clinical presentation was having boils, vesicles and all, but still we gave Tikshna, right? If you look into the ingredients of the Bilwadegada, they all are Tikshna, Ushna, Sukshma property are there. But still, in a condition which is caused due to same etiology, like Tikshna, Ushna, Sukshma property, we are using that only, right? So I will explain you why it is. Now, I commonly use this, one of the image to explain, like, you know, it is like fighting swords. Here, what is happening here? The people are fighting. One side they are having swords, other side they are having guns. So the people with swords are fighting the people with guns. No, who will win? 100%, the one who is having guns will win. So likewise, to combat this one, these people have to fight with the guns, right? The etiology is like that. So when a disease is caused due to Tikshna Hetu, Tikshna Beshaja should be used. It is called as fighting guns with guns. Okay, I will explain you what is the meaning of Tikshna. I will explain you. Now, Tikshna versus Tikshna, right? Tikshna should be, mighty should fight against a mighty, right? So it's like that. So in case of, just a minute. Okay, so when in this one Tikshna that led to the manifestation of the disease is Ahita Tikshna, and the one which cured that manifestation is Hita Tikshna, right? Hetu is Ahita Tikshna, Aushada is Hita Tikshna. Now further I will explain what means further, what else can be considered as Tikshna. Now Tikshna also means acuteness of the disease, sudden onset, severity of the condition becoming very severe immediately, or the fast progression of the disease. This can be one. Now, when it comes to Aushada, this type of conditions require quick action from the physician as well as from the medicine, right? The Vaidya should also act fast and the medicine should be acting fast, right? It should be quick acting. Now, in this, what is very important is, I think I forgot to put that slide. Now, what is, for example, you take example of Chitraka. When you apply, Chitraka is Tikshna, right? When we apply Chitraka, it causes immediate burning, boils and all, right? So, karma is quick, right? So, Tikshnata means karma is also. For example, there is severe burning sensation. We apply Chandana. Chandana as such, Dravyataha, it is Saumya. But immediately it is reducing this burning sensation, right? So that is also Tikshna. So when it comes to Hetu Tikshna, there the burning and all, whatever the manifestation is, that is to be considered Tikshna. Here in Aushadha Tikshna means we have to consider it as fast acting, quick acting, right? So that is why Bilwadi is having Tikshna, Sukshma properties. So that is why it is quick acting, Tikshna. That is why I call it as Tikshna Aushadha. Okay. So in this Bilwadi, Vishwishwaragada is Saumya, Bilwadi is Tikshna, and Dashanga is Ati Tikshna. Only these three Agadas will be discussing probably in this webinar. Okay. Now, generally, I use Vishwishwaragada in case of allergic manifestations, chronic itching dominant conditions, and prevention of the recurrence of any disease. Okay, commonly use it in psoriasis prevention and all. Bilwadegada, mild infectious conditions with Pitta Kapha association, fever will be there, Shota is there in such conditions. We use it, right? Am I audible? Somebody raised hand. Am I audible? No, no. Please. No. Raising hand means I am audible. Yes, okay. Bilwadegada we use in case of, where fever and all is there, infection type of presentation is there we use. Dashanga is still more Tikshna, means fast acting. Don't think here, another context, Tikshna as Tikshna like Chitra. No, Tikshna means fast acting. It is fast acting, right? So Dashanga is still fast acting. So in my experience, I'm telling. So it is when highly infectious conditions are there. At that time, we use like Bilwadega, Dashanga. Fast spreading is there, Pitta dominant, Pitta Kapha associated conditions. In such conditions, we use Dashanga. Okay. Now we'll see some cases. Now this patient came with a erythematous, scaly lesions all over the body. It was diagnosed as erythrodermic psoriasis, but I had a doubt whether it is erythrodermic psoriasis or not. I thought it may be a pityriasis, but it was diagnosed as erythrodermic psoriasis by a modern dermatologist, so nothing to worry. And even if it is, whether it is pityriasis or exfoliative psoriasis, whatever is the clinical presentation, that we are going to see, right? The clinical presentation, based on that, we'll be planning the treatment. Okay. Resident of Goa. So on the first day, here you can see erythematous, mild scaly lesions all over the body since 1 week. Complaints of aggravated since 2 days, associated with itching and mild dust-like scaling. Okay, patient is suffering from these similar presentations for past 5 years, right? There is a history of 5 years. Okay, what medicines we gave him? We gave him on the first visit, Patolomuladi Kashaya, Dushi Vishari Patolomuladi, 15 ml twice daily on empty stomach. It causes loose motion and it causes severe pain abdominal. So for that, you need to read Patolomuladi Kashaya, then understand what type of diet we have to explain to the patient, right? Okay, some points I will tell, some points you have to contribute to yourself, right? Then it will become good understanding, right? Dushi Vishari, 2 tablets thrice daily after food with honey, and Puducherry Kashaya 15 ml thrice daily after food it was given, and Nalpamara Thaila was given for extra application with coconut oil. Okay. Next visit, the Patolomuladi changed it to Patolokatranadi, and others were same. Now, what we did here, we added Surya oil, that is Kutaja Thaila. Pitta was reduced. So Pitta means Kutaja Thaila is more Tikshna. When Pitta association is more, at that time we should not use it. So Pitta was reduced, so we switched to Kutaja Thaila, or you can get Surya oil or any Ratia tinctoria oil. Okay. So then we planned Virechana to prevent, like clinical presentations were reducing. The patient was almost asymptomatic. He was relative of one of our colleagues. So he insisted him to undergo Virechana. So we did Virechana. Tikthagrata Snehapana, Nalpamretela Abhyanga, and Truthlehe Virechana was done. And follow-up medicines were given as Guduchari Kashaya, Dushi Vishari, and Eladi Thaila. Now this is after treatment. You can see, I think for complete that's it is that duration and all. It was span of 2.5 months or 3 months maximum. But these scars will stay for some time. So when I looked into these scars, then I confirmed maybe this may not be pityriasis, because in pityriasis, when skin lesions go, these type of scars are hardly seen. So I persisted with what the modern doctor diagnosed it as erythrodermic psoriasis, like that. Okay, here you can see the lesions are completely free, and it's been almost 4 or 5 years. Patient is completely all right. Now this is a 56-year-old female, came with PDCAS. Male, okay, male came with the complaints of these type of bullseye lesions all over the body, right? They were there all over the body since 3 years, and he had severe edema on both the axilla since 1 week. Okay, he had taken all the modern treatments. He was admitted in major hospitals and got treated. 3 years back, patient was said to be apparently healthy. One day he developed a few pedicars on face and slight itching, for which he took some tablets. He was practicing. He was not a doctor, learned like practicing, okay, in a village. And then a cream. On third day onwards, the condition started worsened. He stopped the medicines. Fifth day, PDCAS spread all over the body with severe burning sensation. Okay, then these are called as bull's eye lesions. Okay, I will explain you what it is. So all over the body he had. So sorry, diagnosis, but I have not added. So this patient went to modern doctor. They diagnosed it as erythema multiforme. It is one of the severe condition. In this, every part of our body, including mucous membrane, is affected. I have not put some of the photographs which are not good. He had lesions even in eyes, the eyelids and all, nostrils, oral cavity, on genitals, everywhere. Everywhere he had these type of lesions. We started here with the Patolaka Pulmonary Kashaya, 15 ml QID, that is 4 times a day. Dushi Vishari, 2 tablets thrice daily with Kashaya. Trifla Kashaya, half teaspoon, 2 teaspoon with hot water at bedtime. Nalpamrethele extra application 3 to 4 times a day. And through next day, it was patient was not having with Trifla Churna, there was no motion. So next day we gave Triutlera. Okay. But with that also there was no motion and all. Fever and increased burning sensation, he complained. So Bilwadegada was replaced, like by replacing Dushi Sharegada, we put in Bilwadegada. As I told, whenever fever is there, we go for Bilwadegada. And external application, because of severe burning sensation, we went with Kumari Swarasa Lepa. Okay, 10 days after, you can see marked reduction was there in the lesions. Okay, marked reduction was there in the lesions, but the pain you can see on his face, still he is in pain. It is, lesions have reduced in severity, but the pain is still there. Imagine now what may be the quantum of pain when it started, when it was in severe situation. See, all over the body. I told you these images I have not shown you before treatment because they are very too ugly. Okay. So all over the body. This is then at first discharge, 19 days of total treatment. Your patient was like this. Okay. Then we discharged the patient. So discharge medication, Nimbari Kashaya 15 ml thrice daily after food. Dushi Vishari 2 tablets thrice daily after food with Kashaya. Nalpamrethela was given for extra application. Avoid, he was a chain smoker, so avoid smoking, and every day he used to eat non-Western meat, so we asked him to avoid that. Okay. After 10 days, came with severe pain and pus in the right axilla, which was mild in the beginning. Now it is increased, slight on left side and slight itching and burning sensation all over the body since 3 days. Smoked 5 to 6 cigarettes a day for about 8 days and even had mutton. So that got, because of that, it got aggravated. Here you can see, sorry for photography, here improper photography. Here is the lesion, axilla on both sides. Right was more, left was not so severe. Now you can see this is the presentation, right? This is on right side, this is on left side. Here, this one we diagnosed as Kaksha. In modern, it's called as hidradenitis suppurativa. Multiple pores will be there. They are interconnected. They are channelized inside. And wherever, if you press here, they will be oozing from here. Like if you press here, as they are interconnected, they will be oozing. Okay, so like here you can see, here it is pressed. They are multiple porous. Okay, this is called as Kaksha, which is explained in Shudra Roga. In modern, it's called as hidradenitis suppurativa. This is, you can see the outcome. The patient, I was telling you, genitals also. See, this is after complete treatment. Okay, then we did Virechana to him and same medicines were given for a few more days. I think 3.5 months or 4 months we treated him and he was perfectly all right. So last, I think this is the last medicine. Here, what was given? No. When he came with this, when he came with that heterogeneity of a presentation, this was the situation of other lesions of the body. Okay. So here we gave Ayaskriti. Ayaskriti usually I give at the end to prevent further accumulation of the clay there and bring back the normal color and all. It helps for that. So Ayaskriti contains Asanadigana mainly and then Loha. So 15 ml thrice daily after food. Dushivshari 1 tablet thrice daily after food. Nalcomretel X application. Avipatti SOS because frequently used to had difficulty in, or mild constipation. So for that it was given. Now this is after 20 days of that. After 20 days of that, this is in OPD, it's not in IPD. So this is, you can see, he was now perfectly all right. See, periodic suppurative on both sides, it is completely gone. So 3.5 or 4 months we treated him. This is another case of gutted psoriasis. He was a farmer and probably I thought he developed it because of pesticide exposure, like repeated spraying of pesticide. So that inhalation led to the toxicity and he developed this one. Severe Vata dominant was irregularly spreading. So Vata dominant dry lesions were there. So first we did Gudichari Kashaya, Dushivshari Gudika, Surya oil and honey. That is for Dushivshari it is given. Gudichari 15 ml twice daily on empty stomach with hot water. Dushivshari 2 tablets thrice daily after food with honey and Surya oil for extra application was given. Next visit, Gudichari continued and it was added. To this, we added Aragudari Kashaya. Third visit, Gudichari Kashaya, Aragvardhani Rasa, and Gudichari was given after food, Aragvardhani before food, and or in between food, it can be given, but we usually give in between food. Narsimha Rasayana was given on empty stomach twice daily. As I told, it is Vata dominant. Rukshata was there, so some Rasayana was needed. And Manjistari Taila was given for external application. Here you can see, this is at the second visit. And this is at the last, means when he came for at this stage, when we were giving Vicharikasha and all, at that time, this was the condition. So this was the condition, and this is finally, once he completed that 1 bottle of Narsimha Rasayana, and this was the presentation, you can see. Even scars and all have markedly reduced. On legs are. Okay. Fourth case, here sudden onset of reddish papules on lower and upper extremities, on lower abdomen associated with burning sensation, rare itching and swelling, which was spreading proximally since 8 to 10 days. Mild muscular pain and pain abdomen, few pustular lesions on the dorsum of both feet, and there was no fever. You can see 5/10/2020, you can see the lesions, right? On both legs. She was brought on wheelchairs. She was not able to walk because of this. Okay, and the hands also there. So she was given 40 mg steroid per day. Antibiotic were given and analgesics were given. That course was over, so they were stopped. And it was diagnosed as leukocytoplastic vasculitis or hypersensitivity vasculitis. And for that, that treatment was given. But as I was telling, Hetu is very important. Most often what happens, these present-day Hetus are, like we consider them under Dushivisha, low potent poisons. So here, the major problem is the gap between time of exposure and onset of the clinical presentation, right? Time of exposure and onset of the clinical presentation. Here you can see what we were able to elicit in this patient was, prior to onset of the current complaint, she visited her grandmother's home in Kolhapur, and then while playing, she accidentally stepped on ant hills or ants where multiple ants were there, red and small. So she got bitten by multiple ants on the legs. Okay, and kids, when they are very busy with playing, they neglect it, right? She just wiped and neglected. So after 2 to 3 days, she started to develop these reddish papules on both legs, which gradually increased in severity, consulted modern doctors, and they diagnosed it as hypersensitive, like leukocytoplastic vasculitis, and treated. Now, what happened, etiology, why it was neglected? Because this, you can see 2 to 3 days gap is there. Means today there was ant bite. Today is Friday. Monday or Sunday, patient is developing burning and all. Now, even patient is also not able to give that history. Doctor is also not able to ask such questions unless that person is in Agatantra department, like us. So we evaluated and we came to know that it is caused because of ant bite. So we considered it as Pittaja Kitavisha. Agneya Alpa Sansrava, there is no Srava, oily presentation is there. Daha is there, Raga is there, Visarpon. It is fast spreading. Okay. So that is why it was considered as Pittaja Kitavisha. Okay, treatment was Patolakatroinadi Kasha, 7 to 10, 8 ml thrice daily after food. Bilwa Dekada, 1 tablet thrice daily after food. Tushi Vishari, 1 tablet twice daily on empty stomach with honey. Nalpamreztela for frequent application was given, and she was given in return that how to taper that steroid. Right here, the patients, as patients started tapering the steroid, the complaint started aggravating. Right, this is 5 to 10 we started. This is 7-10. Complaint started aggravating. This is, see, you can see here, she had no lesions, but they started developing. But the important thing is suffering was not there. Visible changes were there, increased, but there was no suffering. And I should be very grateful to the parents because it's a kid and parents persisted with us. See, this is where the education plays very important. Patient education. We educated the patient. As you start reducing the dose of steroids, 100% there will be increase in the clinical presentation, but don't worry, it will subside like that. So we have to convince them, we have to educate. So they got educated and they started believing. Then we continue with this treatment, right? Here you can, on 7, you can see patient came with the complaint of pain abdomen. So for that, Ingvastic Churna was given 1/4 teaspoon. And in place of Nalpamreztela, Manjistazitela was given. Others were continued. Now, after that, we started getting the report on WhatsApp. See, these are reduced. Complaints are reducing. No steroids since 4 days. Still lesions are there, but not completely gone. So no steroids since 4 days, but severity is reduced. No steroids since 7 days. So at this time, we stopped Patolakatroinadi, continued Bilwadi and Dushivshari, and Nalpamreztela was reintroduced. This is 4th November. Okay, it was 5th October, right? We started. This is 4th November. Almost all lesions have gone. Only Dushivshari is there and Nalpamreztela is there. Mid of the November, Dushivshari is also stopped. Only Nalpamreztela is there. This is 22nd January. No medicines at all since 2 months. And this is March 2021. No medicines since past 5 or 6 months. Why we have done so much of follow-up? Because we wanted to publish this one, and because this case, leukocytoplastic vasculitis is having severe or most common recurrence. So we wanted to observe whether the patient will have a recurrence or not. So fortunately, there was no recurrence, means we were able to treat it successfully. That is what we used. Patolakatroinadi, Gudichadi, Nimbadi Visharati. Only Patolakatroinadi, not Nimbadi. Patolakatroinadi, Dushivshari, Bilwadi, Ingvastic Churna, when patients are having pain abdomen. Manjistazitela and Nalpamreztela. Right? Only 6 drugs we used and we were able to treat it successfully. This is another same case. This is a first visit when he is a safari driver. Again, the diagnosis. The patient diagnosed it as the case of leukocytoplastic vasculitis and treated. No relief at all when patient came to us. History again, he was a safari driver. Means he used to take people to Dandeli forest for safari where he was bitten by multiple insects. See here you can see there is a brown black spot. This is insect bite. See here also there is an insect bite. This was neglected. So when patient came to us, we diagnosed it as again as Kitavisha, Pittaja Kitavisha and treated with same. See, Patolakatroinadi 15 ml 5 times. 8 a.m., 11 a.m., 1 p.m., 4 p.m., 8 p.m. Bilwadi Gada, again 5 tablets. Pitta Kashai, 8 a.m., 11 a.m., 1 p.m., 4 p.m. and 8 p.m. Dushivshari, 2 tablets, 5 times, same. 10 minutes after above medicines. These were given. Why it has been, if you read hypersensitivity vasculitis or leukocytoplastic vasculitis, you will understand. Because roga is very Tikshna, means disease is very fast spreading. So, Aushadha should also be Tikshna, right? So, because of that, quick action was required. So, that is why so much of intervention, like, multiple doses are given. Because you all know that in Visha and Shwasa, Aushadhi Sevanakala is muhur, repeated administration. So, it was given. So, when we do like this, see, this is the importance. Like, not only selecting right medicine is important. It is important, but how much, how long it is to be given, that is also very important. So that we need to keep in mind, right? Okay, then on 3rd day, we revised the treatment. Patolakatroinadi chegape, Gudichadi Kasha, Dashangagada, 1 QID, Tiktakagrita, 2 teaspoon morning on empty stomach as Shamana. Erythaila was given for extra application. It is a thaila at that time I had. It was and should be grateful to Manmatan Vaidya sir who gave me this oil. This is explained in Mandali Visha Bruna. Okay, the Shangalepa at the joints where he complained of pain. So this treatment was continued till 6th day, and on 6th day, Taila was changed to Durvadi Taila for extra application. So this is sorry. Now 18.5, you can see this is the condition. 19.5 and 22.5. These spots will take some time to go. I think in that kid you have seen the spots are nothing but there is petechial hemorrhage, that staining, discoloration will be there. That takes some time to disappear, to get back to normal color. So 18, we started the treatment, and 22nd, you can see the patient is perfectly all right. 18, 19, 20, 21, 22, 22. Now 22, 5 days. 5 days, but how many times do you give medicine? Per day, 5 times. 25 doses of medicines have been given in 5 days. So we got this outcome. Okay, do not force with every drug. Okay, don't think like, no, we are giving some Rasaushadhi, let us give 5 times, 10 times. No, it's not like that. The Agadas and the condition. Yoga and the Aushadha, both are very important. When it is to be given, what is to be given. Okay, this is, we'll discuss one more case and I think we'll wind up. This is a patient who, old one, but still I'm showing you to create that interest because you need to trust Agartha Tantra, right? You should not treat Agartha Tantra as a subject just to pass, anything and get BMS degree, right? You should understand the potential of Agartha Tantra. So that is why I'm telling you. This patient had this type of lesions, hard hyperpigmented lesions on exposed areas. Whichever part of the body gets exposed to sun, they he used to develop this, right? You can see this is hard, very hard, rough on legs, you can see, right? Okay, it was diagnosed as Darier's disease. It is one of the very, it is having a genetic predisposition and a genetic involvement is also there. And there is no treatment in modern science. There is no treatment for this in modern science for this Darier's disease. So as the disease was having aggravation on exposure to sun, light, and solar exposure. Now, what is the definition of Agartha Tantra? Dushitam deshakala diva swapna rebikshasha yasma dushayate datum tasma dushisham smutat. So, when there is change in external environment, that is, you consider it as epigenetics. Whenever there is epigenetic changes, according with that, if that is favorable with something which is already there in the body, that gets aggravated. So, from where it is coming, it's not coming from the disease, is not coming from the sun. Disease is already in his body. Disease is already in patient's body. What it is then? 100% Dushisha, right? Kaphavrutam Varshagananubandhi. As long it gets avarana of kapha and it stays in the body for years together, and whenever it gets precipitating factors, it gets aggravated and causes the disease, right? It is even true with modern medicine. See, there is, if you want, you can read in pharmacology or something, or research, activation of stored chemicals or stored poisons, right? What they say, when we have a particular diet or when we get exposed to particular environment or particular medicines and all, they make those environmental changes or food or the medicine make our body to secrete some fluid, right? They consider them as solvents. Body, they say that the body secretes some solvents. If that solvent is suitable for that stored chemical, then that stored chemical start secreting or melting or coming into that, dissolving, and that starts spreading in the circulation. So as long as that is circulating in the blood, the person starts suffering. For example, it is a itching. So as long as it is circulating, the person starts itching, right? Once that exposure is gone, means the solvent quantity is reduced, right? So there is no circulating poison now or circulating chemical now. So symptomatology will reduce. But disease will be there, right? This is the experience. So same is true with Dushisha. So in this patient, what it took a lot of effort to convince the patient. I think half day we have convinced him. And very importantly, I was not knowing Darier's disease till I admitted the patient and till I gone through his biopsy. Because I never knew there is a disease called Darier's disease. Okay, but I diagnosed it as Dushi Vishajanya Charma Kushta. Hasti Charma. I consider it as Hasti Charma, Patakafaja, like that. Okay, but I consider it Dushi Vishajanya. So because of that only there was some confusion as I was not knowing Darier's disease. Okay. but afterwards that I read. So we did Snepanavit Kalyanakagrita because Kapavatahara Vishagna. So for that it was used. Eladi Thaila Abhyanga, again Kapavatahara Vishagna. Trivutleha Virechana was done with Trivutleha, 200 ml Draksha Jal. It was good. So after Virechana, first Shamana was Patolakatvani Kasha, Gudichadi Kasha. This is Patolakatvani, the empty stomach, Gudichadi after food, Dushi Vishari, and Eladi Thaila was given for external application. Second visit, Patolakatvani, Mahamandishadi Kada, Dushi Vishari, Eladi. Third visit, Kalyanakagrita. Sarivadya. So Kalyanakagrita is Shamana Sneha, means at this stage, patient has got reduction in the clinical presentation. Kalyanakagrita Shamana Sneha, Sarivadya, Dushi Vishari, Eladi and Manjistadi Thaila alternatively used for external application. See, this is on 25th February 2017, means 8 months later. You may say 8 months, sir? No. For this disease, 8 months, because he is suffering from this since childhood. Now, when he came to me, he was 21 or something like that. Okay. He was suffering from the disease for more than 12 or 13 years. So a disease which is there since 12 to 13 years. And if we are able to cure it in 8 months, it's very good. So here cure is not exactly this complete disappearance of these things. These take time for, coming back to normal skin color. But the cure means now patient is wandering outside. He wears shorts, he moves outside, t-shirt and Bermuda, no clinical presentations. Means the Dushi Vishatva, that Dushi Visha is completely gone. That's the meaning of that. Okay, you can see there was marked reduction. This one, we complete last. This is a more severe condition. This is called as DRESS syndrome. Lady came with complaint of this, was actually discharged from one of the medical hospital, claiming that she will not be able to be cured. Okay, she got scaly lesions all over the body. You can call it as erythroderma or erythrodermic psoriasis also, no problem. All over the body, scaly lesions, you can see. All over the body, she had scaly lesions, swelling, weakness, not able to eat any solid food. Here what happens, she had arthritis problem, for which she went to modern doctor and they treated, and then she developed allergy to NSAIDs. And they diagnosed it as drug reaction with eosinophilia and systemic symptoms secondary to NSAIDs. DRESS syndrome, DRESS. Symptoms, systemic symptoms syndrome. Okay, it was caused due to drug-induced what drugs? NSAIDs. Okay, then somebody is raising hand. Am I audible? Please write in chat or Q&A. Am I audible? People are raising means I am audible, right? Okay, I think I am audible. Okay, then it was biopsy was done. In biopsy, it was erythroderma. So means clinical presentation, clinical diagnosis is erythroderma, etiological diagnosis is DRESS syndrome. So we can see even had diabetic ketoacidosis with erythroderma. So what were the clinical presentations? Scaling, erythema, burning sensation, pain, fever, vomiting, and weakness was there. And there is a history of drug allergy. Now, consider these as the result and this as the cause. So this is Visha, this is Lakshana. So whatever we give for this is Agatha principle, and whatever we give for this is Kaya Chikitsa principle. Blending of Kaya Chikitsa and Agatantra principles. So we consider it as Charmadana. Okay, so Raktam Sakandu, Saspotam, Sarudgalati Chapiyat, Tat Charmadalakyatam, Samsparsha Sam Uchade. So we consider it as that. DRESS syndrome we can read later. So we started with Jwar Chikitsa, 9-5-19. This is Amrut Uttar Kasha, Bilwadi Gada, Punarvadi Kasha is given. Then after that, few days later, we replaced Amrut Uttar Kasha with that of Patolakatvani Kasha. In between, he had cold and cough. For that, we gave Shitopaladi Churna. 25-19, again, there were some increase in the lesions. Cough was increasing, not lesions. So Shitopaladi with Talisadi was given. Punarvadi Kasha, Bilwadi and Nimbadi Kasha was given. 24-5-19, here stop Nimbadi Kasha, Bilwadi Gulika. So we stopped Nimbadi Kasha and Bilwadi Gulika. Punarvadi Kasha, Dashimula Katutre. Cough was still persisting. What is a cough was there? So Dashimula Katutre Kasha and Dushi Vishari was given. So 31-5, cough completely reduced, skin lesions markedly reduced, slight dryness is persisting, no itching, no vomiting, no neck stiffness is there, pain is reduced. Okay, pain and swelling around left ankle since 5 days. So Nimbadi Kashaya, Dashimula Katotraya was continued, Dushi Vishari and Manjistha Taila was continued. So same medicine was continued here. This is on 12/6. You can see, I think 2 months later or 1 month later. You can see she was completely free from the clinical presentations. Okay, but we did not stop there. We had idiopathic hyperglycemia. She developed diabetes also. For that, then we started with other medicines. We treated with Asanadi Kashaya and all. So here you can see Asanadi Kashaya, capsule Nishamalaki, Ushi Vishari Gulika, and Manjistha was given for explantation. 179. Most of the skin lesions are markedly reduced, complain of pain and burning sensation in upper GI, eating spicy food and hyperacidity is there. So Estimadu, Gokshura, Shatavari was given as another rasayana for even hyperglycemia as well as general. Mahasudarshan Ganavati, Asanadi Kashaya and Manjistha lesions over the scalp regions. He had a small boil or abscess kind of lesion on the scalp. So Asanadi Kashaya and Nimbadi Guggul was given. This Churna, Estimadu, Gokshura and Shatavari was continued. And here what happened? Itching symptoms. Patient came for follow-up. Then itching was there all over the body since 4 to 5 days. So I don't want her to take any risk. Itching should not aggravate. If it gets aggravated again, she should not develop any skin lesions like that. So I thought itching maybe because of Gugulu. Sometimes it happens in some people. So I replaced that Gugulu by Dushi Vishari and others were continued. And she was having Pandu Varna. She was very pale. So for that purpose, we added Swarnamakshit Basma with Guduchi Sattva. Okay, like 100 gram Guduchi Sattva to that 5 grams Swarnamakshit Basma, mixed thoroughly, 1/4 teaspoon, something like that it was given. This is 15 to 2020, you can see. She is perfectly alright. Even that pale appearance, that also is fine. Okay, so it was stress syndrome. We consider stress syndrome as Dushivisha. As scaling was there, erythema was there, Paka, premature aging of the tissue. Pitta, it was responsible. So we concentrated mainly on Pitta. And then ketoacidosis was considered as Ajirna. Again, Pitta, Kapahara Chikitsa, and Agni Dipanapati. So what we did overall, Vishagna, Dushi Vishagna, and Chwaragna Chikitsa, we did. You can see then outcome. Okay, we will go fast and we will finish it. Okay, so some other conditions also we can keep. Okay, use. I don't want to drag this time now already. So overall, what we need to keep in mind is Agadas alone will not be effective. Like we diagnosed it as a Visha condition and we give Bilwadekada is suitable. Let us give Bilwadekada. Okay, no, it's not like that. So that is why blending is very important. Agada principles and Kaichi principles. Or you just don't, if you don't want to call Kaichi principles, no problem. Go with Aushada and Prashamana. Okay, Aushada is Agada, Prashamana is Doshagna or symptomatic management, whatever we mean. Means Karya and Karana. What Agadas Aushada we are giving for Karana, and what Prashamana we are giving it for Karya, right? So Agadas alone will not be effective. They are to be supported with the right Shamanivitas. Do not hesitate to use Tikshna Agadas even in Pitta dominant conditions, because Agada we are not selecting based on dosha presentation. Agada we are selecting based on the strength of the etiology, right? How quick is the disease, how fast it is spreading. Based on that we are selecting Agada, right? For dosha presentation, we are selecting anyhow. We are selecting Shamana, right? So understanding Hetu plays very important role in selection of medicines. Don't try to copy anybody's treatment. Copying will not make you successful. Understanding the principles behind everything is very important. So rather understand why those medicines are prescribed. We need to understand that. Okay. If you are very much interested in learning dermatology, there is a scope. So I just wanted to tell something. So I have a course. We have a course, 20 hours exclusive digital course, online course. Anytime, anywhere you can watch. It's Ayurvedic management of psoriasis. Is only on psoriasis. Means if you once attend it, once you go through the live sessions of doubt clearing, question answers and all, I'm very sure that you can independently practice only psoriasis also. Or you can, I can say that out of 10, you can 7 to 8 patients you can successfully treat. And that 7 to 8 patients successful treatment is a huge, what you can call it, outcome from anything that we learn. But it is not for free. It is available on ayurvediskills.com. If you want, you can visit our website, or through which you have joined this page. That page itself is our website. It is a paid course. Actual price is 11,000, but no need to pay 11,000. We have there is discount, that is 5544. 5,544 is the current price. This Dasara offer, and it is for available for limited period. If you have any doubts, you can call me, no problem. And that's it. And I have a YouTube channel, Dr. Mahesh speaking, where Samhita Appan and all will be going on. You can attend, you can watch that, and subscribe to my channel. And thank you for joining us. And very sorry for that in between glitches, technical issues. Namaste. Thank you.